Namaskar. Today we will study penicillin antibiotics. So penicillin antibiotic is a beta-lactam antibiotic, and these are called beta-lactam antibiotics because they have the beta-lactam ring. This is the beta-lactam ring which is essential for its antibiotic activity. So beta-lactam antibiotics can be of four types: penicillins, cephalosporins, monobactams and carbapenems. So penicillins again they can be divided into different generations, and with increased generation there is increased spectrum of activity. So first generation is penicillin G, penicillin V, oxacillin, cloxacillin. Second generation are the aminopenicillins like ampicillin, amoxicillin. Then third generation like carbapenicillin, propenicillin, ticarcillin. These are all carboxypenicillins. Then fourth generation mesalocillin, azulocillin, piperacillin. These are the ureadopenicillins. So if we see the mechanism of action, then as we know, peptidoglycan cell wall is unique to the bacteria. No such substance is present in higher animals or human beings. So peptidoglycan, the essential component of the bacterial cell wall, can be targeted, and beta-lactam antibiotics inhibit the peptidoglycan biosynthesis. So the building block unit of peptidoglycan consists of one N-acetyl glucosamine, one N-acetyl muramic acid, then these 5 amino acids L-alanine, D-glutamic acid, glycine, then 2 D-alanine molecules, and to this third amino acid, this glycine, there are further 5 glycine amino acids bind. So this is one building block unit, and you can refer to our earlier class on peptidoglycan biosynthesis. Then this building block unit is cross-linked to form the peptidoglycan, and the enzyme required for this cross-linking is transpeptidase and carboxypeptidase. So penicillin, like other beta-lactam antibiotics, inhibit these two enzymes, transpeptidase and carboxypeptidase, and inhibit the final step of synthesis of peptidoglycan in bacteria. So the bacterial cell wall synthesis is inhibited by beta-lactam antibiotics, the penicillin antibiotics, and since these two enzymes are inhibited, these two enzymes are also called as penicillin binding proteins, because penicillin binds and inhibits these two enzymes. So this is all about the mechanism of action of penicillin antibiotics. Then this is the structure of penicillin antibiotics, and this is the new penicillin nucleus, and if we vary this R, then we will have different penicillin molecules. So here this is the site where amidase enzyme acts and breaks down the penicillin into this molecule. Then beta lactamase here, this is the target site, and once this bond is inhibited or broken, then it also loses its activity. So this is done by beta lactamase or penicillinase. So what happens when the bacteria produces beta lactamase? The beta lactam ring is broken, and in that case the antibiotic loses its activity, thereby leading to resistance. We call it as penicillin resistance or beta lactam resistance. So some of the penicillins are there which are destroyed by gastric acid also, so they cannot be taken orally, because if you take them orally they will be destroyed by the gastric acid. So penicillins are destroyed by gastric acid and enzymes like amidases and beta lactamases or penicillinases. So we can have drugs accordingly, and we have some acid resistant penicillins which we can take orally, that is your penicillin V phenoxymethyl penicillin and phenethicillin phenoxyethyl penicillin, ampicillin, amoxicillin. These are the orally used penicillins because they are acid resistant. Then there are some beta lactam antibiotics and penicillin antibiotics rather, which are beta lactamase resistant. like oxacillin, cloxacillin, dicloxacillin, methicillin, nafcillin. So these are beta-lactamase resistant. And there is one penicillin antibiotic which is resistant to both acid as well as beta-lactamase. So that is our flucloxacillin. So flucloxacillin is resistant to both acid and beta-lactamase. So now we'll discuss the uses of penicillins. We can use them in bacterial meningitis, bone and joint infections, skin and soft tissue infections, pharyngitis, otitis media, bronchitis, urinary tract infection, gonorrhea, syphilis, all these sexually transmitted diseases, then heart endocarditis, oropharyngeal infections. And the side effects or unwanted effects associated with penicillin antibiotics are hypersensitivity reactions. They show allergic reactions, so they should be tested before administration. And these hypersensitivity reactions like vasculitis, interstitial nephritis, skin rash, fever, it can lead to death also. It can be fatal also. So before administration of penicillins, they should be tested in the subject whether the subject is allergic or not. Even if the batch number of the penicillin changes, again the test has to be done. Okay, and this is your immediate hypersensitivity reaction, and immediately you need to give life-saving drug like adrenaline. Then it produces electrolyte disturbances, and it occurs mostly with injectable penicillins that contain sodium and potassium, and they can cause electrolyte disturbances. Then there can also be gastrointestinal disturbances because these antibiotics, these penicillin antibiotics, alter the bacterial flora in the gut, and that lead to this diarrhea. So the diarrhea like gastrointestinal disturbances. So that is another side effect with penicillin antibiotics. Then, as we discussed, some of the penicillin antibiotics are degraded by beta-lactamase or penicillinase. In that case, it will show resistance and it will be ineffective. So, to counter that, we can give some beta-lactamase inhibitors. We call them as suicide inhibitors. And examples like clavulanic acid, olivinic acid, sulbactam, tazobactam, these are used. And example like amoxicillin plus clavulanic acid, piperacillin plus tazobactam. So this is an example of potentiation, because 1 plus 0 is greater than 1. So this is an example of potentiation where this clavulanic acid on its own has no activity, zero activity, but when it is combined with amoxicillin, inhibits the resistance to amoxicillin and increases its activity. So 1 plus 0 is greater than 1. Here 1 is amoxicillin, 0 is clavulanic acid, 1 is piperacillin, 0 is tazobactam. So 1 plus 0 is greater than 1, and this is called potentiation. So clavulanic acid potentiates amoxicillin. So similarly tazobactam potentiates piperacillin. So this is all about penicillin antibiotics. Thank you.